Stop acting like this isn't in your community just because people haven't been tested, because it is in your community most likely. Do not be fearful. China has done and contained this well. Don't stock up on toilet paper. We never ran out of food here in China. It wasn't really the problem. The problem is to try to make people safe. I recommend, for sure, if you're sick or you're going to some place that's crowded, you need to wear a mask, because someone in the crowd is going to have the coronavirus. One thing the mask can do is keep you from touching your mouth and your nose. Here in China, those things are working. We're taking temperatures. Even to get into my apartment, you're taking temperature. We can tackle this, but we can't tackle it with the way that our government is telling us. This is not a surprise to the CDC, and that's their job, to be ready for an epidemic. But guess what? They've already let us down. Oh, ha, ha, ha. Here's the deal. You can't do what you did in the past because this is the novel coronavirus, novel new. It's not acting like diseases in the past. It's new. So you got to take on new techniques, and you got to take on what worked. And what worked is what's happening in China. Hi, my name is Michell Savu. I am a U.S. board certified and trained general surgeon who's been working in Beijing, China for the last 2.5 years. And I am very concerned about the world's response to the COVID-19 disease. So I thought I would just give my opinion, and it's an educated opinion. I don't mean to criticize. I want to just give information and what I think is happening, especially in the United States, which is concerning me now. So today's number, it's March 14th, 2020, and we're in the middle of the coronavirus crisis pandemic now. Basically, the world has looked at the measures that China has taken, and they've called them something called draconian, which means very harsh, and yet they are not acknowledging, at least I don't think my country's has acknowledged, that they are very successful. I do think that the WHO leader from Canada, Dr. Alwad, has acknowledged that China has done something that's unprecedented. They were able to contain the virus very quickly, and as a result, they decreased the total number of people who died from this virus and the total number who got the virus by acting very quickly to quarantine people, quarantine whole cities. And I think most of the United States and the world knows that now. The problem I'm seeing is the lack of intensity and response from the United States, and I think the lack of dissemination of information. And I just were making this video just to disseminate information, and because I think that the United States people are much smarter than what they've been given. And my concerns with the United States started with the first cases as they got reported in Seattle. And you have to understand, my son was here in Beijing with me, and I sent him home with teacher friends who are all doing online education anyway. So I sent him back to the United States, and they live in Seattle. So I was very interested to watch what happened in Seattle. And once I saw what happened in Seattle, it upset me so much and concerned me so much that I realized it isn't true that the CDC is doing the right thing. It isn't true that the CDC is prepared. So the reason I say that is the first death that happened in the United States in Seattle in the nursing home. Right after that, I watched via YouTube, a woman had just come out of the same nursing home, and she had just visited her mother, elderly mother, in the nursing home. She had no idea that there had been a corona-related death in that nursing home, and she had no idea that there was danger to both her and her mother. Quite frankly, that would have never happened here in China. As soon as there was a confirmed coronavirus death, then Chinese officials would have completely shut down and quarantined that facility. They would have quarantined all the health workers in the facility who are at great risk and likely the ones who brought the virus in from the community, and they would have absolutely not let any visitors come in. So not only did the CDC fail the that nursing home incident, that was my alarm bell, that I had believed that everything that the U.S. had been told, we're getting ready, we're ready. Then once they said they didn't have the coronavirus testing kits out, I became even more concerned and realized they don't have a handle on what's going on. And rather than criticizing what China is doing, I think that we need to follow what China is doing. So basically what's happened in the United States is the epidemiologists have been telling the advisory team the whole time and said, look, the regular flu, they've already lost 14,000 people in the regular flu. Those epicenter in Wuhan, they've lost about 2,500 people. That's where the coronavirus started. That's probably the worst of the worst. So since they lost 2,500, we're not going to do quite the draconian methods that they did in China, because we don't think that we can, and we don't think we need to, or we're concerned about the stock market. I'm not sure. And so basically they just calculated. There's a calculated risk on the experts' part in the United States, and said, okay, let's say we lose twice as many people in this coronavirus thing. We lose 5,000 people. Okay, we're willing to accept that because we've already lost 14,000 or so from the normal flu season. That's what I believe happened. So take it for whatever it's worth. Now, however, right now, today, looking at the Worldometer site, on the number of new cases in China are 11 in the whole country. I live in Beijing. It's a city of 21 million people. The whole time from the beginning of this virus, now we're into 9 weeks of the quarantine or so, we've had 8 deaths in a city of 21 million. Seattle has 20 or more deaths already, 30 I think, in a city of 700,000 people. That it doesn't take a scientist, it doesn't take an MD to understand, wait a minute, there's something seriously different about what's being done. The US has decided that they're going to take the backstage approach of, well, we'll continue to let people travel. We know it's already into community spread. One thing you can understand about the epidemic is, one, it starts with cases, goes to clusters, and then goes to community spread. They know in the United States it's already to community spread. And they keep saying, well, our numbers are low, we're not too worried. This is what the White House is saying. The numbers in the US reported today, 2,291, about 3,000 cases. But here's the point, but there's 600 new cases in the United States over the last 24 hours. The reason the numbers are low in the United States is because they're not testing. The numbers are likely 10 to 20 times higher than those numbers. The U.S. task force knows that it's community spread. They know it's going through the communities. They estimate on the West Coast that it spread 8 weeks before it actually started to hit those nursing homes. And why did the nursing home people die? They died because they're older. They've also been telling all the Americans, you're going to die if you're older. This is really only affecting. No, that's not true. The first person who died in the Philippines flew from Wuhan to the Philippines. He was 41 years old. He looked like he was getting better, and then boom, in 24 hours he died. It is not just old people who are dying from this. The truth is, yes, the numbers are lower than this influenza season, but I think it would be better to educate the Americans as to the true risk and let you decide what you want to do. My parents are in the United States. They're in their 80s, and they are, I've told them to stop going outside, stop going to church, stop going to any unnecessary thing. And of course, older people go to doctor's appointments, which my parents are doing. So doctor's appointments, you need to be wearing a mask, because where are sick people going to go? The difference between this virus and the other viruses that have come in the past are that it is spreading in patients before they have symptoms. This is not like the influenza virus, the normal flu season virus. The flu season usually doesn't pass on until someone has symptoms. So at least they know, oh, I'm getting sick, I better take precautions. This virus is spreading in people that are not sick. And we know that. That is not an iffy thing anymore. The other thing that can happen is while the children are not getting sick, they can and are getting infected. They're just not getting sick from it. However, they can infect other people. China, 80,000 total. It spread to Korea. They're neighbors. Of course it spread. The total today in South Korea is 8,000. It spread to Korea before it spread to Italy. The number in Italy today is 17,000. What's the difference in the response? The difference in the response is Korea acted more like China, and Italy took the stance that the US is taking. So I need the Americans to know, here's your choices. You have to decide which one you're going to do. Are you going to be Italy with 17,000 new cases today? No, new cases 2,500 in the last 24 hours. 17,000 total. Now here's the point. Italy's population and Korea's population are about the same. Italy's, I think, 61 million, and Korea is 51 million. But their responses to the outbreak were completely different. They have tested 200,000 people, over 200,000 people in Korea. They allowed people to drive by with their cars. They would take a swab from their mouth, and they got the results in an hour. In Italy, they didn't do that in the beginning. They, like most of the Western world, just said, well, we're weighing the risks, we're the experts. Okay, here's the deal. You can't do what you did in the past because this is the novel coronavirus, novel new. It's not acting like diseases in the past. It's new. So you got to take on new techniques, and you got to take on what worked, and what worked is what's happening in China. Now, you can say, don't wear a mask. Well, the reason the masks are working is everyone's wearing them. So someone who's sick and they don't know they're sick, they're keeping from spreading it while they don't know they're spreading it. So if you wear a mask, it's 60% effective. They wear a mask, it's 60% effective. You effectively have cut your risk down in half. We're reusing masks. Don't think that we're just wearing them once. We don't have that many masks either. Instead of the Surgeon General saying to the United States public, oh, ha, 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 people, stop buying the masks. We need them for the healthcare professionals. The healthcare professionals and the CDC should have had this under control and had warehouses stocked. Harvard has a warehouse of stocked supplies for epidemics just like this. This is not a surprise to the CDC, and that's their job, to be ready for an epidemic. But guess what? They've already let us down. They don't even have enough test kits to start testing people. The numbers in the United States are not realistic numbers. They just haven't tested people. So, Korea looks like they've got it under control because they locked down their system, they locked down their country, they closed the schools, and they took immediate action. Italy is frightening right now. And if you talk to the ICU people, I listened to a JAMA podcast yesterday with an ICU intensivist care, very intelligent, very well respected ICU intensivist from Italy. I think it's Dr. Cucino. And he said, we are in trouble now, and there's no treatment for this. Only lay people believe we're going to get a vaccine. Lay people, non-medical people. Those in the medical world, we know we're not going to get a vaccine fast enough to keep people from dying. I wish our government would come out like the UK government came out yesterday and said, look, we're in the middle. We're not testing you because we already know lots of people have it. 80% of the people who get this disease are going to have a mild disease. And that's why the United States isn't doing much about it, because they said, okay, 80% are going to be okay. But 12% are going to get a serious disease, and they're going to need some kind of support, supplemental oxygen, something else going on. And 5% are going to be serious, and they're severe, and they're going to be on ventilators. We need to be ready for this. We don't have enough ventilators for all the people who are going to get sick. If you get the numbers like China, let's just say you get 80,000 in the United States. There's 1 billion people, over 1 billion people in China. There's about 330 million. Let's just say, because U.S. hasn't locked down, that they get somewhere near the number 80,000. So you say 5% of 80,000 are going to be severe. That's 8,000 is 10%, and 4,000 needing respirators at the same time, ventilators. That's why we're not ready for this. My suggestion to the lay public is stop going to restaurants. Stop acting like this isn't in your community just because people haven't been tested, because it is in your community most likely. Do not be fearful. China has done and contained this well. They have already shut down. They built these temporary hospitals in 1 week, 10 days, and they've already shut down the first hospital because they no longer need it. We can tackle this, but we can't tackle it with the way that our government is telling us. I'm just giving you the information. You do what you want with it. The CDC has already let us down. They don't have the equipment out. That people will be fired over this. I guarantee you. They're not admitting it now, but trust me, by the end of this all, they are going to be fired. I can't believe. My colleagues here in China, my medical colleagues have said to me, what is happening with the U.S.? Did they already give up? The U.S. has decided it's so wise that it's going to rely on things that are from past epidemics. And they're playing the numbers. The epidemiologists are playing the numbers. They know people are going to die, and they know not all of them are 70, 80. So my advice to you, you have an older person in your family, 70 or 80, they need to stop all activity. They don't need to be flying anywhere. They don't need to be on cruise ships. They don't need to be doing anything. They can order online. They can order their food in. They can, and the younger generation needs to help them learn how to do this. I recommend, for sure, if you're sick or you're going to some place that's crowded, you need to wear a mask, because someone in the crowd is going to have the coronavirus, and we don't know who's going to pick it up. You might, and someone else might not. But if you're outside, it's less dangerous because more air particles moving. If you're in a confined space, less dangerous. Those who are going to larger meetings, churches, I suggest the churches invest in churchonline.org or Zoom meetings and perform those online services. Doesn't mean you have to stop. That's what we're doing here in China. We're all very familiar with Zoom now. We have small group studies with Zoom, churches coming from Zoom or churchonline.org. These are all set up and ready for you. Please start doing this. Please suggest to your communities to do this. Don't stock up on toilet paper. We never ran out of food here in China. You're not going to run out of it. We have 1 billion people, more than 1 billion people in China. You're not going to run out of food. That wasn't really the problem. The problem is to try to make people safe. Make safe, eat at home, close the schools. But Britain has probably been more honest with its people and said, listen, we're not putting you on a quarantine like in China because we don't think you're going to stick to it for 8 weeks. The peak in the United States is about 8 weeks from now. Right now it's March 14th, so the peak is going to somewhere be in May to June, and they're predicting that also in Europe. So the highest number of people are going to be happening in May to June. What we need to now do is decrease the height of the peak. We know there'll be a peak, but we want to decrease how many people are getting it. And the way we're going to decrease is social isolation, distancing. You need to stay 6 feet away from anyone that you're near, wear gloves outside, have hand sanitizer. Washing your hands is the number way to prevent it. Having your kids wash their hands is the number way to prevent it. Wearing a mask is going to help you, because what happens is you touch your face. Study's been done. You touch your face 27 times an hour. And it's really hard to stop touching your face. So the mask can help you to stop touching your face, because what happens is you can pick it up on surfaces. You can pick it up from other people. Not just someone coughing and sneezing on you. It's on surfaces. So if you touch something and then you touch your mouth, and you just inadvertently scratch your eye, then you're going to transmit it into your mucous membranes, nose, eyes, mouth. One thing the mask can do is keep you from touching your mouth and your nose. But if you're going to touch the front of the mask, that's not a good thing either. Wear a mask as you like. But here in China, those things are working. We're taking temperatures. Even to get into my apartment, you're taking temperature. Take your temperature. If it's over 100.5, that's a low-grade fever. You need to call your doctor. Don't go to your doctor. Call your doctor and tell them, I have a low-grade fever. The main symptoms are fever, cough, dry cough, no sputum, and myalgias, which means you feel achy all over. If you have a fever, if you have a cough, and you have a myalgia, there is a high chance that you may have the coronavirus. 80% of the patients are going to do just fine with a mild symptoms. Do not go to the doctor. You are overwhelming the system. Call your doctor, tell them what's going on, and then they will instruct you to do what's next. You don't have, for my medical colleagues, we didn't have the RNA testing right away, and we didn't do RNA testing on all the febrile patients. If the patient had a fever, we had a designated fever area of our hospital. We did a complete blood count, looking for absolute numbers of lymphocytes, which are decreased. And we did a chest CT, a screening chest CT to see. If either one of those were positive, then we would go on and send the samples off to the Chinese CDC. Now we have antibody tests, and I'm hoping the US can at least step up and get the antibody test, because you can just send the antibody test off in your local lab, in your own lab. And if the antibodies are positive, then you know that's a one positive step. You put the person in isolation, and then you send off the RNA PCR to confirm that you have it. So there's a lot of information, but you can do this. Italy has a warning for the United States and the rest of the world. You need to do what China did. Italy finally has done it. Talk to Dr. Alwald. I hope I'm saying his name right. He was with the World Health Organization that came to China, and he came back very complimentary to the Chinese people. Do not use your prejudice against the Chinese people and their government to say we're better. Look at Italy. They have amazing doctors in Italy, and they are totally caught off guard. They have more cases than Korea, more than double the cases of Korea. And we know that's true because Korea has been tested. Make your own decision with accurate information. I believe that the US population is smarter and more disciplined than our government is allowing for. And I believe the CDC has definitely let us down. As a precautionary measure, then we need to take this into our own hands to help ourselves and our family. We don't need to panic and we don't need to fear, but we need to have information that's accurate and real. And we need not to be told that this is not a serious issue. And you need to know why the US is telling you these things. The epidemiologists have given the numbers. They've decided that's okay with them. You make your own decision. Again, I'm Dr. Michell Savu. I'm an American surgeon, deputy chief of surgery at an international hospital here in Beijing. I've been here since the outbreak of the virus, and I'm a fellow of the American College of Surgeons. And I have seen what the Chinese have done, and I believe they've done the right thing. Let's hope we can all weather this storm together. Thank you.